I apologize for the delay. We were waiting for the other file to convert to the from the academic affairs meeting, so I apologize for that. Okay, Mr. Stern, I believe we have the panelists all in attendance.
Okay.
Will you please stand for the Pledge of Allegiance?
Yep.
I pledge allegiance
allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, I'll call the meeting to order at 7:07. Again, we were sorry for the delay. Roll call, Ms. Pertinio.
Mr. David Bradley,
Here.
Mrs. Rita Spinelli,
Here.
Mr. Larry Stern,
Here. And at this point, I'll turn it over to Mr. Cleaver to review the policies on the agenda.
Okay, thank you. The first policy we have is policy 146.1. We did touch a little bit on this. I know it was the same committee for the academic affairs that is also for the policy. This is a new policy. This is required. I believe Ms. Spinelli touched base on this a little bit at the academic affairs about trauma when we were talking about the social and emotional learning pieces for our students. At this point, our district is currently doing trauma training for our staff. We do have, like I said, relations with St. Luke's and Lehigh Valley. If they do send out information, we also do send that out on our weekly updates. I believe one in November that came to us from St. Luke's, talked about different things back to school, mental health, gave different apps for parents and students to look at. It talked about grief, loss, and trauma, coping skills for parents, teachers, and students. So there's a lot of resources that we have been sharing to our Lehighton community. But in addition to that, our IU also offers trainings. And on September 3rd of this year, our staff was trained in Trauma 101 and self-care by the IU. I do know Mr. Tack set this up with that. And just a brief description of what those trainings consisted of is Trauma 101. That was a 3-hour presentation. It included explanation of the impacts of trauma, the trauma continuum, how to be aware of trauma, information on the types, the causes, and different things. So it really, was a long presentation, but there was a lot of great information with that Trauma 101. And also, there was also what we called a self-care workshop that was offered to our staff that they took part in. And that talked about a little bit of trauma as well, but it also talked about self-care for the individuals, talking about their levels of stress, looking at student strengths and needs, barriers that students may be having that they can see that is affecting how they can engage in the education. And so it really kind of not only talked about trauma for the students, but also talked about trauma for our staff. It was very well received with that as well. But this policy goes into a little bit detail of those type of trainings that are now required. And like I said, we were actually doing this at the beginning of the school year, even before, without having this policy. It was, required, and we were making the effort to do what was required of us. And wanted to thank Mr. Tack and his team of putting those trainings together. Any questions regarding this policy? Okay, next policy.
Yeah, no, Mr. Cleaver, sorry, I just wanted to state that I do like how it talks about the secondary area of trauma and not only the primary part of it, and then the collateral damage that can occur from, and how to treat that collateral damage from a trauma perspective, from not an immediate, but like a secondary perspective.
Yeah, and it has been a great help, and I know Mr. Tack wants to chime in on this as well. With our, let's see if I can put Mr. Tack, there we go. With our social workers and how they really assisted with, a lot of this as well. So I don't know, Mr. Tack, if you could expand on that. Nope. Okay.
Okay, can you hear me now?
Yep.
Okay. Yes, I want to say with the trauma, and that actually started even last year with guidance counselors and our social workers, and they brought that to light. And like you said, we're continuing to do that. That is very important. That's one key piece as we're working with the Lehigh Valley Health Network, as well as the IU. And I think it was very informative for staff because a lot of them really started to see the big picture of how these traumatic events, which we may not think is trauma, but for kids and for adults and community members and parents, it can be. And, it takes on all different sizes and shapes and different events. And it was very eye-opening to them. And that's the whole thing that, as we were talking about a little bit earlier with Lauren, with ESL kids, or not, excuse me, with the social and emotional SE kids, is that if we can get more of those training programs for all staff to become aware of, it just gives them more tools in their tool bag to help deal with the children on an everyday experience, and especially in times like now with the COVID. So, we're thankful for that. I know with the trauma, they talk about safe to say and all the different messages that the principals and you yourself, Mr. Cleaver, are getting at all hours, all days, 24/7 all year. And those then get relayed to the necessary people and trying to deal with that. And I know I was with an administrator this afternoon and they had a safe to say. So, it's things that are really stepping up and ramping up, and we like to stay ahead of it. And we're thankful that we can do that and really tap into the community services for that.
Thank you, Mr. Kramer. The second policy is the sick leave 334. You can see, let me scroll down, sorry. You can see the recommended changes here in green. Many of this, is recommended us because of the change in requirements. For example, it's not only a physician certification that we could get LPNs, LPAs, we get nurse practitioners, we get excuses from all of them. And so this just talks and explains that what it used to be just a physician certification. But it has, of course, expanded now with the sick leave for the district. So again, the green is what is being recommended to change. And then in the last part here, it talks about the district, if they resign or leave the district for another reason outside of retirement, then of course they're not eligible for the payment of unused sick days that they may have accumulated at this point. So that part was added as well.
Mr. Cleaver,
Yes, sir.
before we even go through this policy revision, we really should be looking at this collective bargaining agreement that is way overdue. Here you are cornering and changing policies when the collective bargaining agreement has not even been complete. It's putting the cart before the horse. To do so would handicap the negotiations team if you're going to adopt policies that are different than what were there before and that are going to provide a variety of different benefits without even being negotiated. Well, how did this get on this?
None of this changes any of the current language in the current contract we are under.
But that's the point. We're negotiating the current contract.
We are following, but there is a contract that we are following.
I understand, but
we're
we're negotiating a contract and changes, hopefully changes are being made to that contract. You don't want to corner or handicap your negotiating team with changing these policies.
None of this is handicapping.
It is, because the negotiation should be related to all of these benefits. These are part of your benefit. Sick leave, with and without pay, this is all part of the contract. This is all part of the contract. This does not belong here until after that contract is negotiated and a new contract is formed, because employee benefits is a significant portion of our collective bargaining agreement. And those benefits should be reviewed by our team. Specifically, when you look at the salary schedules in relationship to benefits, it would behoove all of us in our community to provide a higher salary for higher skilled staff with a slight reduction from the Cadillac plan of benefits, because with the higher salary, they'll be capitalizing in the PEASers for their pensions throughout the rest of their lives. This is wrong. This is backwards.
None of this policy has.
I understand you don't believe that, and that's fine. But you're not the board member, and you're not here with oversight. We're here with oversight.
Mr. Bradley, I'm here with oversight.
Yeah, I know.
I do not believe that this
That's a shame.
has anything with the contract. This is the definition and a process of taking a sick day or multiple sick days and how it is to be administered by the district. Not the number of sick days you get, not the payout of sick days, not any of that activity that is related to contractual information.
But yet it addresses the contract. Line, what is it about? Paragraph 1, 2, 3, 4, 5. Paragraph 5. Pull it up. This is related back to the collective bargaining agreement. Larry, I appreciate what you're doing, but Larry, you're not doing your job, man. You're not doing your job. Don't argue with me.
I don't need you to criticize my job.
I am criticizing you. You're my government. You're not doing your job.
Opinion, and the rest of us have.
No, Larry, it's not an opinion.
Thank you very much for your opinion.
Larry, it's not an opinion. Larry, it's not an opinion. It's a statement of fact.
Is there any other questions?
Do not shut this off. You have
Thank you.
Go back to
Mr. Bradley.
Mr. Stern. Go to paragraph 5. We're discussing the policy.
I'm reading the last comment. I'm reading.
No, sir, you do not have the last comment. That's not how this works. We're on the board.
I'm reading the last comment in the policy. If you would shut your mouth so I could talk, sir. That it says, compensation plan, individual contract, collective bargaining agreement, or board resolution. It says it adheres to that policy or that document, not that it is superseding that document.
Thank you. Do you have that document now for the next upcoming year, sir?
Every board
And 6
member
months
has
later,
copies of the contract.
Mr. Claver, please stay out of this. This is a discussion between board members.
We're not having a discussion. Okay.
You're shutting down
Is there
debate, sir.
any other questions?
I have a right. You got Gail has her hand raised. Let's hear what she says. But the reality
any
is,
other questions regarding this policy?
yes, the question regarding this policy is it doesn't belong here.
Mr. Bradley, that question has been answered. I'm
Mr.
sorry
Cleaver.
you don't agree with that answer.
Yeah, because you're on a different team. I want to be on the
No.
team of the community. Yeah, Larry's on a different team.
No, I think
His
you're on a
wife's
different
on this
team,
collective
Mr.
bargaining agreement. His staff members, his family used to work for this district. Look, we have a job to
That
do.
benefits, Mr. Bradley.
You have a job to do, sir. You're not doing
Any other
it.
questions? We're going to do
No,
our
you're not
best.
going to shut it up. No, I have a right to
moving
speak.
on. Thank you.
You do not have the right to silence this. I have a right
This
to
is
speak.
the policy
Mr.
334.1,
Cleaver, you
the
do not have
sick
a-
leave bank. We're going to try and get through this as well. This is a policy that's currently there. The changes again for this are in green. You can see that going through this policy has been, was adapted in 2001. It was again revised in 2016. This is just adhering that before sick leave bank usage can be utilized, that all days are warranted. So the sick leave bank is, staff can put days into the sick leave bank, up to 2 days or 1 day, depending on what they wish. And then if they get an extended illness, they're able to apply to the sick leave bank and get additional sick days if approved. But before doing that, they have to exhaust, all their personal and vacation days.
Mr. Stern.
Any
Mr. Stern, hold on.
questions
Mr. Stern.
regarding this policy?
Mr. Stern, in reference to this sick bank, are you going to allow the public to make comment prior to the recommendation to the board to advance this policy in this committee meeting?
Again, Mr.
Like
Bradley,
you
have
failed
been
to do in the
explained,
last
there
one,
is
sir.
no
You
action
truncated.
taking activity. How often do
truncated.
we have to continue?
That's your opinion, sir. Larry, I need to know your opinion. Larry, are you going to allow, like you just did on the last one, You truncated the conversation. You shut me down.
You
Shut
made
me
your
up.
point. You
And
made your point.
Listen,
fine.
sir. Listen,
No,
sir.
and
It's
you
not
know
only
what?
my
People
point.
can make their point at the board meetings.
No,
concerning
sir.
it.
You have a responsibility in this committee meeting to allow the public to speak prior to recommendations, official actions by this
They are
government
not,
agency.
Mr. Bradley, we're not going to argue with this. I'm sorry, these are not official actions. There
They
is
are
no
official
vote
actions. They're
being taken.
recommendations to the board to move this policy forward.
The official action is taken at the board meetings.
That official action is, and
There's
this official
actually
action is
committee
a
meetings,
recommendation.
Mr. Bradley, where people don't even allow public comment because of no action.
Then that's a shame because it's wrong. The Sunshine Act
That's your
requires it.
opinion. No, again,
The Sunshine Act requires it. I'm asking the elected official, Larry Stern, not you, sir, as a subordinate superintendent that apparently was supposed to be trained to the Sunshine Act.
We're using the derogatory language again, Mr.
It's not
Bradley.
derogatory to call him a subordinate. He is a
We're gonna
subordinate.
move
That's
on.
how the line.
As
That's
your
how the
comments are
organizational chart
always
is.
the same.
Larry, please.
Thank you. Thank
Are
you,
you going to
David.
allow
Thank you.
public
Again,
comment or not, sir? Are
family
you
and
going to
medical
allow
leave.
public comment, Larry?
We will have it at the end. Thank you,
Not
Mr.
at the
Bradley.
end, prior to making your recommendation, prior to
Mr.
official
Bradley,
action.
no.
What do you mean no? I'm not asking you. I'm asking Larry.
No.
Larry,
No, it works.
tell me
No,
no.
no.
Tell me no, Larry. Tell
No,
me you're
Larry.
going to block public comment, Larry.
We are going,
I want to hear
there
it.
is no blocking.
I want the
public
judge to
comment.
hear what you're
They
saying,
will
sir.
have the opportunity. At
I
the
want to
end.
make sure you have the judge's approval.
So,
I
when
want to
we
hear it, Larry. Are you
have
going to block it?
335,
Larry, are you blocking public
335,
comment?
Family and medical leave is here. This is changes are made through because of change in law to make sure that we are following the FMLA federal guidelines. So you could see that all this falls into that. So we have this listed based upon the recommendations from PSBA to make sure that we are in compliance with current Family Medical Leave Act for our staff. Again, this is recommendations from PSBA to allow us to be in compliance to make sure we are following the federal guidelines for FMLA.
And once again, Larry, this is a recommendation to the board. You are part of the agency. Under the Sunshine Act, the agency is defined as the body and all the committees thereof. And under official action, number one, recommendations made by an agency pursuant to a statute, which this is made to. If you look at the family leave at the bottom, those are the statutes to which these recommendations are made. Are you going to allow public comment in this meeting, or are you going to potentially violate the Sunshine Act, sir?
Are there any other?
Larry, I need an answer,
questions,
sir. Larry, I
regarding
need
this
an answer.
policy?
You've been warned. It's my objection. 710.1, I'm making an objection that this meeting is not in compliance with the Sunshine Act. Larry, please rule on that meeting whether you're going to allow public comment prior to making recommendations or not.
Stern or Ms. Spinelli?
Mr. Stern, I need a response from
None
the
from me,
government
and
agency.
I just want to
Rita,
say
I need one
that
from you
we
too.
passed all
I
of
wanna
this
add you as
past
a
our
plaintiff.
attorney, and we're certainly able to do what we're doing here.
No, you're not. I'd like to add you either as a defendant or a plaintiff, Rita. Which one are you going to do?
So
Are
at
you going
this
to allow
point,
public comment or not?
We have no other policies for discussion.
Are you
I
going to
apologize for
add public
the-
comment or not?
Is there any public comment from
Prior
any
to
of
the
attendees?
recommendation, Rita.
Any public comment from the attendees?
You already made your
Any
recommendation. You shut them
public
down.
comment from
You
attendees?
shut them down. You shut them down. You already made your recommendations. What's the value? What's the value to their? What's the value to their comment now, sir? Larry?
Ms. White?
Larry, I want an answer. Are you going
Ms.
to be a
White?
defendant or a plaintiff?
Yes, Ms. White?
I'm really kind of sick of you guys all arguing. Number one, can't you get along so everybody can hear what you're saying and let one person speak at a time to figure it all out instead of everybody yelling over everybody? Wouldn't that be a really good idea? You know, we're here for the district and everything. Teachers, you know, who are doing a great job. Everybody's trying to adapt to all this, but it seems everybody's just trying to get over and pull over on each other. I
That's
know,
why we
Mr.
have,
Cleaver, you know I'm already pissed off enough.
yeah, that's why we have an oath of office, laws to follow, and it makes decorum. Before we do any recommendations to our government board as this agency, a committee, official committee, we
Mr.
have a
Bradley, can you please
responsibility.
let Ms.
The
White
fact,
finish speaking?
she did, and she's wondering
No, I
why
don't
the
think
Thank you,
conversation.
Mr. Bradley. I appreciate it. So yes, I would like to hear you speak, Mr. Bradley.
Yes, I appreciate it. And you are correct. The fact that we have two people that either have to decide to read the Sunshine Act and comply with it and either be a defendant or a plaintiff. This agency is not, in my opinion, not following the law by any means. And if it did, we wouldn't have all the problems. We wouldn't have the conversation. We'd allow the public, the stakeholders to participate in these meetings, get their input, and then improve the district. We have tons of problems within this district. We have a collective bargaining agreement that has not been resolved yet. And yet here, this board, this government agency is taking action down a path that's going to corner Larry later, and he's going to make statements like he has in the past. Well, we can't do anything about it. It's our policy. Self-inflicted wounds.
Mr. Bradley.
Mr.
again,
Cleaver,
please
I am
don't speak
speaking.
for other individuals.
I am speaking, and
Is
I
there any
will
other
speak for
public
Larry.
comment?
He is a
There is none at this. There is
Larry-
none at this time.
Mr. Bradley, you don't
I
need
w-
to stand on your soapbox about.
I
the
will say on my
Sunshine
soapbox, I
Act
gotta ask you the
because we
question.
have
Will
cleared
you allow
everything
public comment prior to
we
making a
have
recommendation
cleared
in a
everything
committee
to
meeting?
our Council.
We
Please
do that
don't
at every
talk
school
over.
board meeting, Mr. Bradley.
Mr. Stern, in a
Again,
committee
Mr.
meeting,
Stern,
will
there
you
are no
allow
other
public comment prior
Request
to
for
taking
comment
action?
from the attendees.
I want to hear your answer, Mr. Stern. The court will want to hear your answer, Larry. The court will want to know. Will you allow public
And
comment?
the
Mr.
court can
Stern,
ask, Mr.
we
Bradley.
have-
Let the
Why don't
court
you
ask.
answer first so that I
We
can take it
have
to the court?
offered public comment at every
I need it
committee
prior
meeting.
to the action, sir,
There
prior.
is no action at.
It is an
committee
action.
meetings.
It's
I
a
know you have hard
recommendation
time
by
understanding.
a committee.
Again,
It's part
Mr.
of the
Stern, we
agency.
keep going over this. There is no other
I
requested
agree,
public.
Mr. And I will take a,
Well, Larry, are you going to make the statement, Larry? I want to
I'm
hear
going
what
to
you
take a
say.
recommendation to adjourn the meeting.
Larry, I want to hear what you say, bud.
So moved. I vote we
Don't
adjourn.
silence this community.
Move, we
And I-
adjourn.
Don't silence this
Second,
community.
The meeting is.
Don't silence this
Thank you, and
community.
again, we
28
apologize for
p.m.
disrupting.